think we'll go ahead and get started.
Hi.
Welcome. I think we have like 60 some people here, so we got a great turnout. Thanks everybody for being here. I'll start off by just talking about budget for a little bit. The budget situation that we're in really began several years ago, to be perfectly honest. And, you know, I think everybody has heard about the need for ISU to contract from a budgetary perspective over the past several months. We were asked early on this fiscal year by the governor to send 1% of our budget back. We were also told at that time that we'd likely have to send 2% back for next year, fiscal year 21. And we were working on that budget over the course of really October, November, December, and into even February. And all of the different academic units put together new budgets with guidance from our new Office of Finance and Business Affairs, really driven by Jen Steele, who's our new budget director at the university, and Glenn Nelson, who's the vice president over finance and business affairs.
Okay, no.
I think that some people still aren't muted, so it's probably best to stay muted if you can. We're just still getting some background information or background noise. As the COVID crisis worsened, the state became acutely aware that tax revenues were going to be significantly impacted, both income taxes because of unemployment, as well as decreased sales tax revenue because people just aren't out spending money. And so a few weeks ago, we were asked for an additional 5% back. Every state agency, every state-funded entity was asked for that kind of a budget cut. So over the last 2 weeks, we've been scrambling, and I would like to thank our finance team, Brian Hickenlooper, Joe Wilcox, Sabrina Corgatelli, Kim Richter, many other folks in the academic units who have spent a crazy amount of time over the past few weeks trying to put together new budgets for us to, within the division, cut up to nearly $2 million out of our budget. And so I wanted to thank all of you for that work. I know that some of the questions that people have will be about those budget cuts. What we have tried to do is cut our operating expenditures and cut, if we have to, open positions rather than cutting individuals, people that are existing in those positions. And we can talk about cuts further. We have, within the university, put together really 3 budget scenarios. That is a 4% cut, a 5% cut, and a 6% cut. And these cuts have been asked for on an all funds perspective, meaning not just appropriated dollars that come from the state in the form of general appropriation and tuition. That's our appropriated portion of the budget, but also on our local accounts, which in the Division of Health Sciences are very, very important. Because we receive professional fees, we receive our clinic revenue, indirect costs from grants are placed into local accounts, and we have a significant portion of our budget, somewhere in the range of about 40% of the divisional budget is in local accounts. So we've been asked for an all funds budget cut, and we have, I would say, 99% complete budget proposal for the division that will then be presented to the Leadership Council. And Leadership Council is the president's group that has all the deans present and many of the other unit heads. That will be presented next week over a couple of days. All the different units in the institution will be presenting their budget, and obviously the DHS will be a part of that. So we have put those budget cuts together. and we'll be seeing just exactly how much of the cut remains to be seen. The process after next week, basically when we present those budgets, is somewhat unknown. I assume that the Office of Finance will be collating all that information and then make a proposal for the university budget cut to the state for some sort of approval by the Department of Financial Management at the state. I'm going to pause there and see if there's other information that I can clarify about the budget if folks have questions, and you can shoot those off with the chat feature to Ginny.
Hey Rex, okay, we have a question. Has the State Board of Education approved the 2021 tuition and fees proposed by Idaho State?
Yeah, that happened yesterday. And in fact, the state board met via Zoom, just like we're doing yesterday, and approved the tuition and fee package that that we proposed, which really was holding tuition and fees constant for in-state undergraduate students. Out-of-state and graduate students may have seen an increase in their tuition and or fees, even our professional fees in our proposal.
Okay, next question. Is the university close to approving some form of Verisign to expedite the signature process?
So that question came up yesterday. There are lots of processes being evaluated by the university to improve workflow and the flow of paperwork. Obviously, it's even more critical that we're working virtually. And so Verisign or DocuSign or systems like that have been considered. And I think that there have been a few glitches with some of these processes, but I think that we are moving towards having more electronic signature capability. Yes, I will say that most of those processes are implemented by Finance and Business Affairs. And they're very, very busy doing budget work right now. And so there may be some delays in how we roll out those new workflows, but people are definitely thinking about that. And I think we're actually operationalizing some improvements in workflows across the university.
Okay. Rex, the legislature approved a 2% increase for all state employees across all agencies. In light of the budget holdback, will ISU faculty staff see any kind of CEC increase?
My guess is that we will not see an increase in CEC this year. That hasn't been officially announced, and I'm just, I'm speculating a little bit. But I will say that there have been some media outlets. I saw a news report the other day that said that we weren't going to get the 2%, but I haven't been able to verify that yet. And it hasn't come up in our admin council meetings. I will tell you that, it doesn't make a lot of sense to give us a raise on our appropriated money, which generally speaking, the amount of the raise comes on the general fund dollars, which is about 25% or so of our budget. We then make up for the rest of the budget and the rest of the raise with our budget with an increase in tuition, and sometimes in the division with an increase in our professional fees. Well, we've held tuition and fees relatively constant this year, and we're being asked for a cutback. So in essence, having to fund a raise is an additional cut, if you will. And so my guess is that we will not be seeing a raise this year. And that would really only complicate things and create a greater financial hit in all of our departments, because that's an additional 2% that we have to find when we don't have increasing revenue for the most part. That is tuition and fees. I hope that makes sense.
Okay. Each department has to do a 4%, 5%, and 6%, or as a whole. So the question is, department has to do 4, 5, 6%, or as a whole, health science has to come up with these cuts?
So we've asked all of the departments to work on a 4, 5, or 6% cut. That being said, some departments can make up that difference in increased revenue. And so I will say that a department like physical therapy, which is growing their programs on the Meridian campus and adding literally hundreds of thousands of dollars to the university's revenue stream, and to their own revenue stream in terms of professional fees, that helps us a ton. The Department of Counseling is standing up new programs. There are other departments that are able to grow their enrollments and add students. And so anytime that we've been able to do that, it decreases the amount of cut that we have to take across the division. And to be honest, we've utilized that at the divisional level. And what I'm saying is that there may be a department in one college that's able to generate revenue that could offset cuts in another college. And so I will say that all of the units have put forth a 4, 5, or 6% revenue cut or balance that, expense cut or balance that with revenue. And that's how we've approached this problem.
Rex, will the budget cuts affect the dependent tuition reduction?
That's a good question. Those tuition discounts that are present across the university, even our non-resident tuition waivers that are utilized very extensively across the university, all of those discounting programs are being evaluated. That is not, the details of that I haven't seen or even heard about, other than we are evaluating all of the different types of tuition discounts, whether it's for faculty and staff, whether it's for spouses and dependents, whether it's the non-resident tuition waivers. All of that is being evaluated. The reality is there are not very many students on this campus that are paying full freight, if you will, to come to ISU, and that's part of this equation. So I would say that it is possible that that could be affected down the road. I haven't heard any details about how that would be implemented, though.
Okay. Can a new grant indirect rate for the upcoming year be used for our department budget to help with the cuts needed?
I'm not sure I understand that. I mean, we have fixed indirect cost rate negotiations that have been negotiated either with the feds for federal grants and for the state. And so those are not typically negotiable, although I know in my own experience when I was working on some grants and contracts, we sometimes could have a discussion with the Office of Grants and Contracts to see if they would adjust those rates or the rates that they were insisting upon if a grant didn't even have indirect, for example. The indirect cost recovery that comes back to departments is open for discussion moving forward, but it's not likely to affect this next budget, meaning the distribution of indirect costs within the institution. That is how much stays in the library and how much stays in the Office of Research and how much makes it back to the academic unit. I think people who've been here for a few years know that distribution changed when Howard Grimes was the vice president for research. There is some discussion that distribution could change by a few percentage points, but I don't think it's going to make a meaningful difference in our upcoming budget year.
Okay. Next, the state of Idaho will get some CARES fund to help it migrate the cost of COVID-19. Do we know if some of the amount will be allocated to higher education institutes?
We do. ISU is going to get a little over $7 million. Half of that money has to be distributed to students. So about 3.5 to maybe even, it might even be a little more than half of that money will be distributed to students. The money comes to the institution through the financial aid system and through the Pell Grant awarding system. So we'll be getting that money fairly soon. I think they're thinking it'll be in the next couple of weeks. We just were talking this morning, the admin council, about how those monies will be distributed to students. We don't have a lot of guidance as to how that money can be spent for the institution yet. And so half of it will be distributed to students for spring semester. There will probably be some to offset some costs in summer, but we'll also be using some of that money to incentivize students to return in the fall. And so that's the plan with the student portion. The $3 to $3.5 million that's going to come to the institution. It's not clear to me yet what the guidance is on how that will be spent. I believe that most of it will have to be spent on COVID-related expenditures at the institution, decreased revenue, increased costs, those sorts of things. And the Office of Finance and Business Affairs has been looking at ways to quantify the cost to the institution, and able to do that kind of accounting. There's also potentially some money from FEMA and other sort of disaster funds, both at the state and federal level. But it's not clear how much ISU is going to get. The CARES fund is about $7 million, though, with half going to students.
Can individual faculty, non-classified employees volunteer to take a percentage compensation reduction to help meet the budget shortfall, or must reductions be achieved through reduction in FTE?
So you kind of cut out, Ginny. I'm
Oops.
thinking. I'm thinking the question was, can people take a voluntary reduction in pay?
Yes, or must reductions be achieved through reduction in FTE?
So at this point, we've been looking at reductions in FTE primarily from open lines. So not filling positions that are currently open. And when this exercise started, the university had over $10 million in open lines, which was obviously the low-hanging fruit, if you will, in terms of how we were going to try to address the budget shortfall. Clearly, some of those positions are critical and have to move forward. And so the question about can people take a voluntary reduction in pay, the answer is sort of. And that is that people can take a reduction in pay, but mandating a reduction in pay when it's not voluntary is not the same as doing like furloughs. And so my understanding after having these conversations with finance and otherwise is that the voluntary reduction in pay issue is not likely to happen, but we may be asked to do furloughs at some point, particularly if we get asked for more budget cuts, which is possible, I suppose, if the COVID crisis continues and the impact on the economy worsens. The voluntary reduction in pay is just difficult because it's not voluntary for everybody if not everybody wants to do it. And so I think there are some rules at the state that preclude us from just sort of pressuring people to take a voluntary reduction in pay.
Rex, could the COVID-19 funds for the institution go toward PPE supplies and departments that have close contact with students, community, individuals?
Again, I'm not 100% sure how we're going to be able to spend that money. It seems to me if it's COVID related, there's a high likelihood that that kind of expenditure could be leveraged. And I think it's a great idea, particularly in our departments that don't have adequate PPE to be able to continue the clinical experiences for our students and other learners. So I think that's a great idea, and I'll make sure to carry that forward as we get more guidance on how we can spend that money. Other questions, Ginny?
Okay, we've got one. What are the specific cost savings from the new organizational model?
That's a good question. Hey, Ryan, I see you've got a visitor there. So the new organizational structure, and that'll be a good segue because I'll talk about the org structure. Reorganizing has resulted in significant savings. And we've been able to utilize a good amount of that savings in our budget reduction. That budget reduction has helped in the College of Nursing. It's helped in the division as a whole. It's helped in circus, and it's helped even in the College of Health Professions. So, you know, many of you will recall, and I'll just transition into the discussion about the new org chart. Many of you will recall that we were approached in late November with by the president to look at restructuring within the division. That was coming about because of really three things. One is we had 3 open dean positions in the division in nursing, rehabilitation and communication sciences, and in the College of Health Professions, or at least soon to be open. And then there were some, I guess what I would call political pressures on the president from the legislature and other political entities in the state, talking about administrative overhead and costs within higher ed. So the president was hearing that, coupled with some of the early budget pressures that we were already feeling in the fall, asked us to reorganize. We went through an exercise over Christmas break and into January, where we had come up with a near final draft, which still preserved a 3-college structure within the division. In response to additional budget pressure and probably political pressure, the president asked us to consolidate further, which is how we got to the org chart that we rolled out, I guess it was last week, with a new College of Health, which is very large and has 2 schools in it, the School of Rehabilitation and Communication Sciences and the School of Nursing. That consolidation did result in savings in really all of those academic units. We will have some new expenses, or I guess a transfer of expenses, because we'll have to hire a dean to run that unit, and we're likely to need to have some stipends for associate deans in potentially the schools that are underneath that college. And so what we have been able to realize, though, is I don't have the numbers right in front of me. Joe was helping me with them this morning, but nearly $300,000 in savings that can be either reallocated to the academic units, and some of that has already been done, or used in our 4-5-6 budget exercise to be able to save some money and not make other cuts within some of the academic units. So I don't know if talking about the org chart will prompt a few more questions, but I'm happy to try to answer those as well. Nothing coming in, Jenny? Okay.
We just got one, Rex. What is the chief medical officer on the org chart?
The chief medical officer is a position that was created earlier last year. The idea behind that position is to provide some oversight, and we have an interim in there. Dr. Jonathan Cree is the interim in the chair of family medicine and chief medical officer. He's doing that in an interim and a part-time capacity right now. That position is to help oversee our university health campus wellness programs, as well as the growth that's occurring in our medical programs. There's a lot of growth going on in family medicine, or at least we hope that it will continue to go on given the potential for budget cuts, as well as growing a psychiatry residency. We've just matched with the first psychiatry residents that will be part of a Southeast Idaho cohort beginning in July. So there are a lot of things going on the medical side of our operation. And there are issues related to facilities. There are issues related to our clinic functionality. And we felt that having a chief medical officer, which also serves as the Department of Family Medicine's chair, was a place to start to have some leadership in that area.
Okay. Rex, this is more of a comment if you want to comment on the comment. The reorganization does not reflect good structure. A mixed match of different entities within a single college will be a bit of a logistical and structural complication. It provides excessive layers / burdens on some and not other entities.
So I fully understand that it's a large, complicated organization, and it's also very disappointing to me personally to basically have something that we've all built together basically have to be torn down and reestablished in another functional level. I'd be happy to talk with people about some detail related to those kinds of perceptions, because we want to avoid pitfalls of this. I don't feel that it's an optimal structure. I think we're going to lose some. I think we're going to lose some opportunities because we don't have the same kind of distribution of duties. We have more people taking on more work in this structure, particularly at the administrative level. And I think that it's. I think that we carefully need to think through how we're going to distribute that work and what the impacts are on the department. So I'd be happy to hear more detail in terms of what people think are the impacts there, because we need to mitigate that the best we can. I don't think that we're going to be able to go back to a different structure. This has been a directive from the president's office for us to make these organizational changes, but I think we need to be able to make the adjustment with the least impact as possible, and I'm open to all kinds of suggestions from any of you about that.
Rex, what is the plan or timeline for selecting a dean or associate deans?
So, obviously we've been tied up with budget and COVID crises, but my intention is to get the dean search restarted fairly quickly. Many of you recognize that we had a dean search going for the College of Health Professions, Laura McKnight's position, as well as we were kicking off a search for replacing Kathleen Kangas, who's retiring at the end of the year. So my hope is that we can get that kicked off ASAP. You all have to realize that we are in a hiring freeze right now. And so that's another hurdle that we're going to have to overcome, is justifying to the state that we need that position and that we need to get that search kicked off. So we'll be prioritizing that at the admin council level. Brian Sagendorf has been working with admin council. We have literally hundreds of over 100 personnel actions that need to be done, at least from the departmental perspective. These are salary adjustment requests, new searches, offer letters, any stage of the personnel activity, and virtually all of those are frozen right now. We did send the first batch of those positions to the state. We sent 30 of them, and Brian Sagendorf got his hand slapped because we sent so many. Well, we didn't send at least 70 others that are prioritized here at the university as being critical to our operation. Out of those 30, we only heard back on about 10 this week. So the point is that the hiring freeze is real. It's being implemented outside of the university to some extent. And the final approval is actually coming from the Department of Human Resources at the state. So it's going to be a challenge for us to get new positions approved or even make changes to existing positions for the short term.
Okay, we have a few follow-up questions for that, so I'm going to jump around in my list of questions here. The first is, what roles do you envision the associate deans would fill in the schools and the colleges and the college as a whole?
Well, I think that there's obviously administrative activities that relate to student affairs, that relate to faculty affairs, that the dean is going to need help with. This is going to be starting June 29th or whatever day of the new fiscal year. This is the largest college on campus. It has the largest number of students, and I believe the largest number of faculty as well. So there's going to be a lot of support that's needed. There also are accreditation needs for some of these programs, and those associate deans will likely fulfill program director kinds of positions as well. I would assume that an associate dean over nursing would also serve as the program director in nursing because they need that for accreditation standards. So the administrative council within the division will help to define the roles of those folks. We don't have job descriptions for all of them. When we did have a large College of Health Professions before, when Linda Hatzenbuehler was the executive dean, we did have a couple of associate dean positions that were needed and necessary. There were course releases and modest stipends for those folks. Tracy Farnsworth, if you remember, fulfilled that role. Nancy Devine was in a role like that. So was Tony Cycle for a time, for those of you that remember that history. And I would anticipate that our structure will go back to somewhat similar as to what it was before. But I'm open to input and I'm open to feedback about what those positions might look like, and that will be crafted by our administrative council moving forward.
Okay, 2 more follow-up questions on this topic. The first is, wouldn't hiring needed faculty make more sense than more administrators?
Well, I think that we have to balance that, and I know that there's the perception out there that excess administrators are superfluous. I can tell you that with our administrative team, we have people that are absolutely pedaling as fast as they can. And if you talk to Patty Marinsek, or you talk to Chris Owens or me, who are the 3 of us are also filling in as sort of a 3-headed monster over the College of Health Professions, that has added very, very significantly to our workload. It seems like we're always dealing with different types of crises. We're having to hire faculty. We're having to stand up new programs. We're dealing with accreditation. We're dealing with clinic activities. We're dealing with personnel actions, and I think that faculty are clearly needed. Cutting faculty lines is not what we want to do, but we have other activities that need to be done. And I would imagine that some of these administrators are going to have faculty duties as well. It's not going to be a simple thing for us to just name new administrators that don't have some faculty responsibilities. So we're going to try to balance the two. I think there's a tremendous amount of work that gets done at the administrative level that not everybody is always aware of, and I'm happy to detail that in more detail to folks. But we have to strike a balance between running the place at an administrative level and running the place at an academic level, and it's a difficult balance to strike. We've contracted. We're going to miss out on opportunities. We get asked to do new things all the time, and some of that has to be driven by administration. And without folks with the capacity to take more on, it's going to be very, very difficult for us to capitalize on opportunities over the next time period. So there's going to be an impact not only at the faculty and staff level, but at the administrative level in terms of the reach and the scope and the opportunities that the division can respond to.
Same topic. Has there been any consideration to the difficulties in finding a well-qualified individual who is both capable and willing to run a college of 10 different units, particularly given our new budget restrictions?
So I think that's going to be a big job. And there's no question that the skill set there is going to have to be impressive. And that's another reason why I think we need some associate deans to assist with that. And we need our department chairs and program directors to obviously be fully engaged in all the initiatives that we have moving forward. I think we're going to have to craft that job description. That's going to, as I said earlier, get some input from our administrative council. And yeah, I mean, in some ways, those two questions are antithetical a little bit, or conflicting a little bit. That is, that this is a big job and we got to find somebody to do it, and the other question is, well, do we really need these administrators? And I would say that yes, we do. These people are busy all the time with a lot of different activities, and this scope of work for the Dean of Health is going to be a pretty substantial one.
Because of COVID-19, is there a need for people to donate vacation or sick time?
So they did change the rules on that. You know, as you recall before, when we had somebody who ran out of sick leave, we had to donate vacation, which never really made sense to me. And I talked with Brian Sagendorf. Brian Sagendorf also talked with the State Department of Human Resources, and they actually have changed the rules on that. So now we can contribute sick leave to people who need sick leave. There is not a tremendous need for that at the present time at the university, but we will keep people informed when we have situations where we need people to donate that. My guess is, and I don't really know the operational activities that need to be done to mobilize this, but there's a lot of money tied up in sick leave in this institution. And I'd love to be able to donate some of my 1,000 hours of sick leave or whatever it is I've accumulated over 27 years here to be able to offset some of the budget impacts that we're talking about here, because that's a pot of money sitting there that that isn't easily utilized. And so I think there does need to be more conversations, not only about donating that to people who need it, but also how do we contribute that potentially to the overall budget situation?
Given the budget situation, will this affect the faculty promotion and tenure process? How will it affect the faculty that are currently awaiting to hear about their tenure and promotions from the provost's office?
So people should have heard about their tenure and promotion. All those letters went out. I saw them this week, actually. So folks should be hearing about that. If you haven't, let Jackie Furio or me know, because those letters were sent out. The real issue is there a raise associated with that? And there is a pot of money. It's only about $300,000, and I say only because we're dealing with millions and millions of dollars in cuts right now. The universities, again, all those personnel actions have been frozen by the state. The universities are lobbying very, very hard with the DFM and with DHR to make sure that those promotion raises, that is moving from assistant to associate or associate to full, that money comes through, because that's an incredibly important part of the academic enterprise and an important part of the accomplishments of our faculty. So I want everybody to know that we have unanimously at the administrative council level pushed forward with making sure that that is a top priority to make sure that those advancements are funded. But we have not heard from the state as to whether they are yet.
Rex, a few weeks ago, funding was approved for phase 2 of the clinic remodel in Meridian. With the recent situation, will those funds still be allocated to finish the remodel?
I think they will, but I will have to check and make sure. Patty, go ahead.
They've already been released, so they are approved, and that's moving forward.
Good. Thank you, Patty. So that's good news, because we obviously need that to support our programs on the Meridian campus. Thanks, Patty.
Okay. Will we be able to leverage work-study funds to employ students for work they could do remotely?
So the answer is we should be able to do that. I haven't heard about the budget cuts to the Workstudy Program. Obviously, some of that money comes from financial aid and from the feds. And I haven't heard about budget cuts in the CPI program. But I do think that we should be looking at ways that we can leverage student workers, that we can increase the contributions that our graduate students make. And those are ways that we can get additional work done and frankly are supportive of the academic progress of our students. So I absolutely think that we should keep pushing for work study, CPI, and the activities of our graduate students.
For those of us going off contract soon, but still needing to come back this summer to finish out clinical requirements with students. Will we be paid?
So those are questions that I don't have an answer for. Obviously, we want to make sure that people are paid for the work that they do. Adjunct money and summer overload type money does not have the same restrictions on it that our other personnel actions do. So I am optimistic that we will be able to complete that. Obviously, some of it wasn't planned for and budgeted because of the COVID crisis interrupting those clinical activities. And that's something we definitely need to be looking at with our finance team and figuring out just how many folks need to be able to do that, to have our students meet the clinical requirements, and how many people are going off contract and need those additional funds. So I will be working with the department chairs and the program directors to get an idea of what that budget looks like, and we'll need to push that forward because we absolutely need to complete those students through their curricula, and we're going to have the manpower to be able to get it done. It's a good point.
With the new structure, will there be encouragement to teach across the college structure for courses that many of the students in the College of Health take to help simplify teaching loads?
So I absolutely think we need to get a task force together right away to look at those courses that can be taught across the division, perhaps in increasing numbers of students in those courses. But there are courses in areas like biostatistics or basic courses in the healthcare system or ethics or other places where they lend themselves very, very well to interdisciplinary interaction and interprofessional education. We absolutely have to leverage that the best we can.
Idaho State University is Idaho's healthcare university. How do you feel that our medical professionals are leading the state in this worldwide health pandemic?
Well, I think that our health professionals have done lots of good things. Our students have done many good things during the pandemic. Our students have been engaged with the health department. They've been involved in other projects, especially here in Pocatello. Our nursing students have been manning the phones. We've had a lot of other engagement of our students. Fortunately in Bannock County, we've still only had 5 cases of COVID. So we haven't had the major critical need for healthcare providers that has been present in other parts of the state. But our students are obviously a critical part of that. Our faculty may be called on at some point in the future to contribute in a variety of different ways. We've been doing a lot of planning for contingencies within the Division of Health Sciences to support the public health department and the hospitals. Patty Marincik's been very engaged on the Meridian campus doing similar things. We've been collecting PPE. We've been figuring out ways to make masks. Our TVAPL has been using their 3D printer. I mean, there's all kinds of examples and many press releases about the contributions that our students, faculty, and staff have made at this time. And I think it's been outstanding, especially given that we're in the middle of transitioning to distance education. We're dealing with students being pulled off their experiential rotations. There's just been a whole lot going on, and a lot of people have rolled up their sleeves and done really, really impressive work.
Rex, if a student in a clinical internship has to take an I for spring and then finish in the summer, will ISU require them to pay for tuition for summer semester?
My understanding is that the answer to that is no, that they will not have to pay additional fees if they're not able to complete this semester. I do want to say that we have, and I think we've talked about this, but it may not have trickled out to everyone. We do have 2 additional end of term dates. They are June 5th, I think, and July 3rd. And I may need to double check that, but it's the first week of June and the first week of July. So that if we're able to get students re-engaged in the clinical setting and complete, they will still graduate, if you will, in spring semester just later than the typical May date. The registrar has set those dates up.
Okay, you may have answered this one, but the State Board of Education put out a plan to return to school. What is your specific estimation for ISU?
So for ISU, we have already made the announcement that summer semester is going to be online for all of those sections and summer sessions. We have multiple summer sessions that begin in May. So all of those that begin in May will be online. We are trying to make a determination of those summer sessions that begin later, say in June. And right now it hasn't been determined if a summer session begins in June, whether that will be online or in person. I will also say that at our emergency management meeting this morning, all events that are on campus, so things like meetings and debate camp and sports camps and graduations for the local high schools, all of those have been postponed through the end of May at this point, and really probably until about June 15th. We will reevaluate as we get later into April, towards the end of April, 1st of May, for how that is going to be rolled out. The public health departments have provided us with a little very preliminary guidance in terms of how we do a sort of an adaptive response to loosen the physical distancing and the stay-at-home orders. Those evolve, at least the recommendations that I've been given by the health department, those evolve over an 8 to 16 week period. So I think it's very unlikely, just my opinion, that we will be having live online classes in any of the summer sessions. I think if things go well and we are able to loosen these restrictions over the course of the summer, it's possible that fall semester could be live. And the way that we're talking about this is, it's short-term pain for long-term gain to be able to get back to a more normal state of course delivery and everything else in the fall. But the other thing that may happen is, as these restrictions get loosened, we may see the blossoming or blooming of disease in certain areas, which would then affect our ability to maintain openness on campus. So, it's very speculative at this point. We've got the stay-at-home order through the end of the month. We know that it's going to take 8 to 12 or even 16 weeks after we sort of start to return to normal to reestablish normalcy fully, as not just a university, but as a society and a community. So I think we're going to be well into summer under the best of circumstances for a return to normalcy. That's just based upon some very preliminary information that I've received from the health department. I don't know, did that adequately answer that question, Ginny?
I think so. And then one that is, I think, partially answered as well, in the same vein. For those of us returning again to clinics this summer to get students finished, do you foresee any return date, or will it completely depend on this rollout protocol?
It's going to depend on the rollout protocol, and it's going to depend on some of the other, restrictions and activities that we have. So, we've maintained some clinical activity for some clinics with physical distancing, with testing patients or clients when they come into clinic for illness, only handling emergency type activities, limiting the number of people that are in clinic or in our waiting rooms, doing delivery to the curbside. There's just lots of things that we've implemented, and some of those things can be relaxed as we get further into a loosening of the physical distancing guidelines. But we're going to have to figure out, if we can get some of this loosening happening, how we're still going to be able to deliver this. But I'm not sure it will just go back to normal quickly. I don't think it will go back to normal quickly.
Okay. And what about additional graduation dates in September for programs that must make up clinical experiences?
Yeah, that's a good question. We obviously have some programs that finish in August, the PA program being one of those. We haven't heard officially from the registrar about graduation dates in that time frame, but those are definitely being considered.
Okay. Have we been asked to donate PPE? If so, will we get money to buy PPE when we get back?
Yeah, so that's a good question. What we have done is, yes, we've asked for PPE. Any of the programs that can spare PPE, Patty has been helping. Patty and Lorinda Smith from the TVAPL have been helping to coordinate that on the Meridian campus, and we have a team of people, including our environmental health and safety folks, who have been collecting and inventorying that PPE. The rationale for inventorying it is so that we can account for the expenditures that departments have had by donating what they have. So the answer to your question is yes, the plan is that we absolutely want it. We would love to have it as much as can be spared. We then will have protocols, and I have a meeting late this afternoon about the protocols that have been developed for how we're going to distribute it and share it to the community, but also make sure that our own programs are supported in the best possible way, and that we have an accounting of that so that folks can be compensated for the expenditure of making that donation, because obviously that's just another hit to our bottom line in terms of having to replace that once we're up, back and running.
Okay, it sounds like it might be in the communication that you're planning to send out, but the question was, who is it that we give the PPE to?
So on the Meridian campus, I think Patty and Lorinda would be happy to talk to you about how they're collecting and ultimately distributing that. There is a wider committee, a university-wide committee, and Chris Owens has been involved in that from the division's perspective. He's working with a woman named Nancy Fox, who's the Director of Environmental Health and Safety. That group reports to Finance and Business Affairs, and Trevor Eagle, who is Glenn Nelson's right-hand man in Finance and Business Affairs, has been the person that's helping to coordinate that overall and on the Pocatello campus. If you need those names again, you can shoot me an email or shoot Patty an email, and we can help to coordinate the PPE pickup and accounting and distribution.
The risk of COVID-19 in eastern Idaho is much lower than it is in Ada County. Will the administration consider all campus for the fall, or could we end up having face-to-face in Pocatello and online in Meridian?
So that hasn't been discussed. When we went to online, we did have, I guess, sort of discussions around that, and that was that it's very difficult for us to have courses that are shared between the two campuses, have different delivery methods. I know that there are some courses that aren't. And so I suppose that could be considered on a case-by-case basis, but for the most part, academic affairs, and this has really been the provost call, what they've done is they've just kind of made a mass conversion to online. And yes, I agree that the disease prevalence and incidences are different on both sides of the state, at least at the present time. But you know, from an administrative structure and from an IT support structure, the decision was made, at least for now, to do kind of an all or none approach. I think we're open to hearing from people who have suggestions for doing it other ways, and providing a rationale to do it other ways. But I think it has to be even more compelling than just how much illness is on one side of the state or the other, because that could change very, very quickly, I think. Still, even though we're seeing trends in the right direction.
No questions right now, which means no waiting if anybody has any. Okay, here's another one.
We're nearing the end of our time too, aren't we? Or are we going to 12?
We did an hour and a half in case there were extra questions about the reorganization.
Yep.
Okay. Next up is there a discussion on deferring incoming classes? Our facility might not be able to accommodate all of them with trying to graduate our current students.
So that hasn't been discussed, but I need to know about those programs, and your deans need to know about those programs if we have those kinds of very significant limitations. There may be some issues that need to happen with regard to overload teaching, or teaching, sort of teaching the last class as well as the incoming class. And so we need to know about those implications in your programs over the as soon as possible, actually. Other questions? We have 110 people here. That's pretty impressive. And I've seen a couple people drop off. That's better attendance than when we have our street tacos for opening assembly.
Street tacos.
Yeah.
We have a question that just came in. Any advice when your department chair is not communicating with the team?
Well, that's not acceptable, especially in times like this. And I realize that communication is difficult, more difficult than dropping into the department chair's office to get some questions answered. We absolutely want to have open lines of communication. That's one reason we're doing this meeting today and another meeting next week to reach out to everybody who has questions. If you're having issues of communication with your department chair, I would suggest you reach out to them again. And if you're not able to get your questions answered and get the right kind of direction, you need to communicate with your dean. I know that in the College of Health Professions, we're sort of fragmented, but Patty and I would be happy to work with anybody who's having difficulty with communication. We want to make sure that we're talking about workload. These issues, people have brought up some very important issues that I am not, privy to the details of how what the challenges are in all of your different academic units. And we need to support you, and we need to help plan for the contingencies that are necessary with the delays in education and with the online delivery transition. So I will be very honest, I don't know or understand all of the issues in every program. And so those need to be communicated through your department chair and up, or program director, and up through your dean. And we need to know about them, because some of the things that you brought up today are very, very important, and probably haven't been addressed adequately to now. So keep communicating with your chair. I would continue to go through that process. But if you're not getting adequate results, you need to come to the dean, or you need to come to Patty or me, or whatever administrative representatives can help support the needs that you have in your department.
Okay. When will information be available on early retirement?
Early retirement is still being discussed, and I think that it will be probably another week or so before we can roll out any discussion on that. I can tell you that the University of Idaho did offer a early retirement or retirement incentive program. They report mixed results, meaning they were able to encourage some retirement, but some of the folks who retired were actually people that were very, very productive and very, very valuable to the institution. And so it's a kind of a double-edged sword, if you will, with an early retirement program. I will also tell you that the U of I does not have the same oversight with the State Department of Human Resources that ISU and BSU and the other institutions have. So any plan that we come up with has a little bit more oversight and a bit more red tape associated with it. So there is some talk about an early retirement plan. they're talking about using the template from the University of Idaho. Very briefly, that program was if you're 55 or older and have been at the institution, and I can't remember if it's 10 or 20 years, then you would be potentially eligible to receive 1/3 of your salary over the next 3 years with that program. It's controversial at this point, and this is for faculty and staff. It would be offered to all employees that meet the basic criteria. And I will say that it is controversial in terms of the I guess overall impact and overall budgetary impact, particularly if we have to then just backfill many of these positions because they're valuable, productive, and critical positions. The total amount of salary savings achieved by that kind of program may not be as much as we think it is. So if the positions are being eliminated in that situation, then there likely is a greater ongoing savings. But that's the kind of analysis that's going on right now, is what is the real budget impact from that kind of a program, who's actually eligible given a certain set of criteria, and whether we should move forward with it. But I think we'll know more in the next week or two as to whether that kind of a program will be offered.
Okay. Rex, how will the new organization chart influence university level representation / governance so the KDHS voice is heard?
So I think that's a really good question. And obviously we had some sticking points with KDHS representation under the 4-college structure. I think that that obviously we have to have the support of the president and the provost to be able to move forward with the right kinds of representation, and I believe we do. There are lots of different committees, lots of different bylaws in terms of how those committees are set up, and there will be an impact on our representation. We'll have to have some discussions with Faculty Senate, for example, and those committees that report up through Faculty Senate to make sure that we do have the right kind of representation. There are many other committees on campus that have their own bylaws, and they will need to be evaluated and maybe modified based upon the size of this new college and all of the different programs that are represented there. So it's a very good point. It's a moving target at this point, but we're going to make sure that we have the right kind of representation moving forward. And I want people's input on where they see those important touch points are across the division and across the university.
Okay, Rex, here's some feedback that we need your response to. Most of the information coming from administration is directed at administrators and faculty. Many staff members feel like we're being left out of the discussion. We are stressed and anxious about our jobs. Yeah.
And I'm sorry about that. And I will provide that feedback back to the president's office and to marketing and communications. And Ginny's hearing it. She works with marketing and communications. I totally understand that people are stressed about their jobs. We have a heightened level of stress throughout the division, and this kind of budget cut cannot come without stress. And so I'm sorry that you guys are experiencing this. It's a difficult time. We need to have the right kind of communication at the departmental level. We are working very, very hard to not have layoffs, to not have furloughs, to not have to move into those, I guess, more extreme personnel measures. What this means is that we are all going to be asked to do more. That's the other piece of this. If we're not filling positions, whether they're staff or faculty or administrative, everybody's going to end up having to do more. And we're going to have to say no to some things too. So I fully hear what you're saying. You need to have communication at the departmental level. I am happy to chime in and provide people with feedback. We are working, as I said, very hard to not have people lose their job as part of this process. That has been, and it's been right from Glenn Nelson and the president. it's much easier to not fill positions than to ask people to leave and to lay people off. And so that's where our focus has totally been up until now. And I'm not saying that that those kinds of layoffs aren't on the table, but they're on the table for all types of employees at the university. But we don't want to have to dip into that type of more extreme personnel action, if at all possible.
I appreciate that feedback as well. I'll take that back to marketing and communications. So the next question, Rex, with the hiring freeze, including reappointments, when will individuals be notified of renewal or non-renewal of their contracts?
So for non-classified staff, the non-renewal deadline is April 27th. That's for non-classified staff. Obviously, if we are getting into layoffs in our classified staff, we then have a very complicated process for folks who have bumping rights. And there are things called layoff units. Those layoff units are typically within, for example, a large organization like the Division of Health Sciences. So what that means is that people with seniority and good evaluations would have bumping rights for folks that are newer to the institution and perhaps didn't get as strong of an evaluation. Again, we're not to that point. We are to the point where there may be some non-renewals that do occur for non-classified staff, but again, it's very minimal. And for the most part, these are personnel actions. It's not just layoffs for a budget reason. These are performance-related issues that could influence layoffs in a very, very, very small number of people. In terms of faculty, those dates are different for different faculty depending on their time and rank and how long they've been at the institution. And so we would have to notify people in fairly short order. And most of the faculty, all the faculty, if there were to be a layoff in faculty, they would get a terminal contract, meaning they would be employed for the next year before being laid off in July of 2021. So, sorry, did somebody start to say something? Okay, I heard a noise. So, there is a long period and a long notification right for faculty if there's going to be layoffs of that type. And again, we're not contemplating those. We're looking at not filling positions rather than laying people off. I want people to be reassured about that at this point. And I'm not saying that it can't happen, and I'm not saying that it isn't at least on the table, so to speak, but that's not the direction that we're going in the division, and that's not the way that the majority of the budget plans have been put forth.
Okay. Rex, the provost recommended careful use of student evaluation this semester for future promotion and tenure. What recommendations and guidance do you have for generating student evaluations this semester?
Well, that's a good question. Our processes obviously are difficult, and our students are, at least some of the complaints that I've heard with the faculty survey that the provost put out is that our students are a little bit less engaged in their classes. And so I think that it's really critical that we incentivize our students in some way to be able to and outline the importance of this, particularly with this change in curricular delivery method, to be able to do that. I don't have any real groundbreaking ideas in terms of having our students make sure that they fill out their teaching evaluations, but we absolutely should be talking with them about it and talking with them about the importance of providing those, because it's even more critical for us to maintain the right level of engagement with those students. And I think that some faculty are reporting less engagement with the online transition, and that's not good, particularly in our hands-on health professions. So I don't have a magic bullet for people to do that, but I think we should probably share best practices and be talking amongst ourselves in terms of being able to incentivize and encourage students to be able to get those evaluations done. We want that feedback, obviously, not just for faculty evaluations, but yeah, go ahead.
This is Chris. This is an issue that came up at Associate Dean's Council and at other meetings that I've been in that have just related to, and I think maybe what the question is also alluding to is the fact that the evaluation that we do receive for this semester needs to be considered in perhaps the light of the crisis that we are all in, because the student evaluation feedback is anticipated to maybe put faculty in a bad place and that they weren't as responsive to my needs. They didn't teach as well. They weren't familiar with the online movement of delivering the classrooms. And it might reflect a really negative evaluation on instructors. And that will need to be considered by department chairs, deans, et cetera, with that special caution and consideration for, say, the evaluations that take place this year. And that is well understood, and that is being taken that way.
Yeah, thanks, Chris. I appreciate that additional context. I would also say that related to that, people are not able to do their research. We're not in the labs. We're not in clinic doing clinical research. There is an opportunity for faculty to ask for a stop the clock or a pause the clock on their tenure and promotion and get an extension if people are worried about that. And the provost, I think, will be quite liberal, just like interpretation of these teaching evaluations should be quite liberal and taken in the context of the situation we're in. The other measures of faculty productivity, including research, also should be interpreted in this context. So I would encourage our department chairs to talk with folks that are stressed about their research productivity and their scholarship, and recognize that a stop the clock or a pause the clock is something that we can certainly consider for people.
Okay. Rex, with the non-classified and bumping rates, is that depending on campus or all of ISU?
That hasn't been worked out entirely, but the way that it's been explained to me is that we have what are called layoff units, if it comes to that, and those are subsets of the university. And I believe that Meridian, for example, is a separate layoff unit from Pocatello, so that we're not going to say that, if you want to keep a job at ISU, you have to move to Meridian. I think there is some geographic separation in those layoff units. If it comes to that, we will clarify that further.
How would a soft money funded position be handled via an early retirement option?
Good question. I don't have an answer for that. But we'll have to put it into the matrix, right? We'll have to put it into the algorithm.
Has there been any progress with obtaining general counsel?
That is one of the positions that was submitted to the state this week to move forward with the search. My understanding is that they do have 3 sort of semifinalists or finalists, and that the president and the search committee are going to be interviewing those folks. It was approved for that position to move forward, as was the chief information officer for the university, which is a position in finance and business affairs. Those were 2 that did get approved by the state to move forward with the search process. So we're hopeful that we will have a general counsel on campus, in the next little bit. At least there's going to be, the search is moving forward with that one, which is more than we can say for most positions on campus right now.
Okay, another position question. Where are we with getting a HIPAA compliance officer for the clinics?
So that's really part and parcel to the previous one. And I have made it very, very clear at admin council that we want to have somebody with expertise here that can help to support HIPAA in the clinics. And we all know that James Francel was, in a way, he was our own private general counsel for the division because he was constantly working on things related to HIPAA and healthcare law. So we've made it clear time and again to the president and to that search process that we're hopeful that the new person would be able to fulfill that role. And I will push again now that I've heard that that position is opening up, and we're going to have folks here that that we absolutely need that kind of support. We're dangerously exposed.
Okay, and then Rex, Jonathan Cree offered to expand on ISU's contribution to the COVID-19 crisis, if you'd like him to weigh in on that.
So I think I saw him sign off a minute ago, but I can talk a little bit about the effort that Dr. Cree and Dr. Solbrig and Chris Boyce, who's our emergency manager supervisor, and Chris Owens are involved with. Maybe it's better if Chris talks a little bit about what's happening on the Pocatello campus with the respiratory clinic ideas. Have you been involved in those discussions, Chris, to be able to provide people with a brief update?
Yeah, sure. Chris Boyce is our Director of Emergency Management here at ISU, but it's been a team effort that has involved Dr. Solbrig being over University Health. It's involved all of our students and faculty in a number of ways. Here's kind of the main ways that it breaks out. One, we are looking to support Southeast Idaho Public Health with the call center, and we've had students and faculty that have been involved in the call center that receives anywhere from 50 to 100 calls in a day about various issues just coming in from the general public. A triage line was set up as part of that for those that are actually reporting symptoms. We've had nursing faculty and students involved in that process, being able to kind of walk patients through kind of a triage process there to see if they can safely stay home or if they need to seek medical attention or emergency attention. So that call center has been one arm of what we've been working on. Then there's been the arm dealing with what about a surge response if there is actually a need for acute respiratory support in a clinic. We probably don't want, and this is all kinds of clinics are saying, we don't want all of these patients going to all these different clinics. If you really do think you have COVID-19, coming to a central clinic in the Southeast Idaho area would be ideal. And so we've developed plans to set one of those up in rapid order here on the ISU campus, with Dr. Solbrig leading the planning process for that effort. We've also been dealing with the assisted living facilities and skilled nursing facilities in the area who are afraid of a COVID-19 patient being up in their population and having that occur, and then having to deal with the other individuals that they're caring for, as well as that patient who has COVID-19. And so we've also been looking at various facilities here on campus and in other areas. We've looked at some of the local schools as well that could serve as a possible overflow treatment facility for patients in the assisted living and skilled nursing population. So that's when another aspect of ISU's involvement. And then the whole personal protective equipment, gathering, cataloging, and inventorying, so that we can support those kinds of efforts that might be taking place here on our campus.
Thanks, Chris. Other questions, Jenny?
That's all we have for right now.
Okay. How are we doing for time? I guess we're 8 minutes till the top of the hour. I appreciate everybody being a part of this, and I appreciate everybody working so hard remotely for our students and for our programs. I know that communication is not the best, and so I really do want you to be able to reach out to your chairs, program directors, deans, and our office at the divisional level. If you have a question that hasn't been answered adequately, there's a lot of uncertainty right now. It's stressful having, if you have kids at home, taking your bandwidth and taking your time and trying to get your work done. So, there's just a lot of transitional stress that's related to everything that we're going through right now. And I want people to know that we're here to answer questions for you. I do want everybody to know that we're doing the best we can to support from a financial perspective, from a budget planning perspective. It's very, very difficult for us to make these budget cuts. Difficult emotionally and difficult even from a financial perspective for us to work through this. So everybody's trying to do it in the most thoughtful and compassionate way. And that's happening all across the institution. Again, I'm sorry that this is impacting all of us in these ways. There's another opportunity for these meetings coming up next week. I think it's on Thursday, isn't it, Ginny? For the division, if I remember right. She's going to check for me. Thank you. But I think it is on Thursday. I don't have my calendar pulled up right now. So if people have more questions or if additional issues come up between now and then, feel free to join that at that time. And again, we want this to be open communication, and folks are welcome to ask whatever questions they have, even hard questions. We're happy to try to answer those. So thank you.
April 23rd at 3:30 p.m. is option 2 for Kasiska Division of Health Sciences.
Okay. So thanks, Jenny.
And it's on the isu.edu/townhall website.
Oh, right. We forgot to give that at the outset. We do have a website set up, isu.edu/townhall, for the scheduling of these. And there are other town halls with finance and business affairs. Some of you may have an interest in joining those, although they're really directed towards not so much informational to the entire university, but to those different academic or non-academic units. But I think you could join those others and ask questions if you had questions for those different academic and non-academic units. But again, thank you. Thanks for taking care of our students and getting them transitioned as best as we possibly can. We have a really difficult time in the division with clinical training as well as didactic and classroom training, and I know that it's been very challenging for all of you. So thank you for your help. Thank you for supporting our students in the institution, and we'll talk to you all again soon. And again, let us know if you have any questions. Thanks for joining today.